Hello, my name is Fatonah Charu. I am a researcher from the Department of Epidemiology, Faculty of Medicine's Prince of Songkla University. This presentation is based on a study titled Surveillance System and Current Situation for Child Maltreatment in Thailand. First of all, I would like to talking about adverse childhood experience. We examine child maltreatment through the lens of adverse childhood experience or ACEs. ACE are defined as potentially traumatic event occurring in childhood, specifically from age 0 to under 18 years. This experience encompasses various forms in child maltreatment, including child abuse, such as physical abuse, emotional abuse, and sexual abuse, child neglect, such as emotional neglect, physical neglect, and domestic violence, such as mother treat violently, household substance abuse, household marital illness, parental divorce, and incarcerated household member. The impact of ACEs is profound and far reaching. ACE can result in a developmental trauma affecting fundamental cognitive ability like memory, logical thinking, ability to process emotion. Childhood trauma tend to be more serious because a child brain is still growing and forming important connections. ACE can affect key parts of the brain that control, and they lead to health risk behavior like smoking, alcohol drinking, substance use, and physical inactivity. More seriously, ACE increase the risk of physical and mental health, such as depression, suicidal attempts, severe obesity, sexually transmitted disease, and various chronic disease. Thailand has a Child Protection and Information System or CPIS administered by the Department of Children and Youth at Ministry of Social Development and Human Security. The system promotes the integration of child assistance and protection processes, proactive child and family welfare provision, and integrate holistic care and treatment with the Department of Mental Health to ensure children receive more comprehensive short-term and long-term psychological supports. It consists of six interconnected operating parts. The first one is the Child Protection Mobile Application Notification System. The system citizen report incident through this mobile application. The second one is the Child Maltreatment Surveillance Screening or CMST screening. The third one, the Case Management Information System. The fourth one, the Protection Practitioner Information System. The fifth one is the Child Welfare Information System. And the last one is Personal Data Verification System. This system receives data from two resources: a report of child abuse by the citizens and the child maltreatment surveillance screening by sub-district level child protection community. Children screen will be assessed and provided with appropriate supports. In this study, we focus on the child maltreatment surveillance or CMST screening. The CMST is a screening tool designed to assess child rearing against minimum standards. It is a proactive, community based method for identifying at risk children. Since 2017, approximately 2,500 screening systems have been in use nationwide. It consists of 32 items categorized into five components, which are physical health, 10 items, mental health, 9 items, parent capacity for child care, 4 items, social and family environment, 8 items, and legal aspect, 1 item. The CMST help determine the severity of inappropriate childcare. The results classify the level of risk, which are the score fewer than 3 items indicates a normal risk level, where the child has no information that require monitoring. And for the score between 3 to 4 items indicates a moderate risk level, meaning the child may be at risk of harm. And the score 5 or above items indicates a severe risk level, meaning the child is at risk of harm. So, the objective of this study is to investigate the situation of adverse experience and child rearing according to minimum standards. Our goal was to leverage this understanding to find effective way to provide care and prevention for children at the community level. For the methodology of this study was a secondary data analysis using CMST data from 2021, drawn from the CPIS database, focusing on children aged 0 to 18 years. We examine dependent variables, specifically the minimum risk level of childcare problems, against independent variable relate to minimal child rearing standards or child maltreatment, as well as several demographic covariation. The data analysis involved the identification. We use the R Studio program for descriptive statistics and spatial analysis, including forest plot and heat map. The expected outputs indicate identifying location and hotspot areas in each region. The results in the study for socio-demographic data of participants revealed that the sample group had a similar proportion of male and female. Most were aged between 7 to 11 years and 13 to 18 years, respectively. For parent, the parent live together, either married or unmarried, approximately 60%, and the rest were divorced or separate. Most had an average of 3 to 6 family members in the same household. The primary caregiver for the children in daily life was mostly the mother, followed by relative and father in similar proportion respectively. And for child living status, more than 99% of children live with their original family. This study will also focus on child labor. The analysis identifies specific area of concern in terms of adverse experience. The national average for child labor of children under 15 years of age is approximately 3 times higher than that of children over 15 years of age. For report of child maltreatment, this chart shows the percentage of 32 child rearing problem that meets the minimum standard, divided into physical health, mental health, parental capacity to care for children, and social and family environment. 20% of children report problem with the minimum standard, with caregiver facing financial problem, debts, and unemployment being the most common problem. at 8% and 7.8% respectively. For physical health, the most common problem was children addicted to game which interfered with their daily life, and the less common was children who gambled regularly. For the mental health, the most common is children inattentive or reckless and frequent put themselves at risk. The less common was children who self-harm. And for parental capacity in childcare, the most common problem is the caregiver use verbal abuse. The least common was failure to register births, and caregiver have a history of violence. And for social and family environment, the most common is caregiver have financial problem, including debts, rendering them unable to care for the child on daily basis are the lowest. And for the risk level of childcare problem affecting children, nationally, 99.4% of children in the minimum risk level category for child rearing problem affecting children were classified as green, meaning no data were found to warrant monitoring. Of these, 80% were found to have no risk of child rearing problem at the minimum standards. And nationally, 0.4% of children in the yellow category were found to be at risk of being affected, with a nearly threefold increase the southern region. The and for the red category was reported at 0.2% nationally, with a twofold increase in the northern region. These with the highest score of 18 were classified as red. These children are at risk of multiple complex and require assistance from relevant agencies for further assistance. And for the association between demographic status and maltreatment, these are the odd ratios and 95% confidence intervals from an ordinal logistic regression model that analyzed demographic factor to find the relationship with the increased level of violence. It was found that the factor with the highest correlation were the marital status of the parent divided into separate, increasing the chance 19 times, and divorce increased the chance 4 times when compared to parents living together. In addition, it was found that the status of children in families living with relatives increased the chance of having a higher level of violence at 4.5 when compared to children living with their original family. As for demographic factor being male age between 7 to 11 years, having more than 10 family members living in the house and non-maternal care increase the chance of having a higher increase the chance of having a higher chance of violence at an odd ratio between 1.2 to 1.5 times when compared to the reference group in each group. In conclusion, the study found that there was less than 1% of moderate to high risk of harm and danger and need protection the screen population indicating a need for protection. Child labor was found 3.6 of children under 18 years old already work for a living. mostly relate to the parental capacity for childcare. The common problem in family were financial problem and unemployment, and abusive language was more common in the caregiver. Game addiction was highest problem in children. So the factors most strongly associated with child maltreatment were divorce or separate family and living with a relative. And for the recommendation, based on this finding, the primary recommendation is that the coverage of CMST screening should be increased. The current study reported screening at a ratio of 1 to 60, and coverage needs to be broad across all areas. Furthermore, future research should conduct multivariate analysis to better understand the interplay of these risk factors. So the program should provide appropriate prevention, especially to divorced family and non-biological parents, and give advice for financial support and employment. And we wish to acknowledge the support of Thai Health Promotion Foundation, the Rajanakarin Child and Adolescents Mental Health Institute, and the Department of Children and Youth. And thank you for your attention.